neuroanatomy of the brain, which is kita akan fokus pada internal anatomy, alright, internal anatomy yang mana kita akan bercakap mengenai struktur pada brain dikenali sebagai basal ganglia. Alright. So topik hari ini saya mengenai internal anatomy of cerebrum, which is kita fokus pada what is basal ganglia and also apa lesions yang buat pada basal ganglia dan juga apa clinical presentation yang boleh berlaku if you have lesion pada basal ganglia. Sebelum saya start, suara saya clear ke? Boleh bagi feedback? Suara saya clear? Alright, okay. Saya start. During our sessions, if you have questions, alright, maybe straight away you boleh open mic dan boleh tanya soalan lah. Kalau macam itu pun boleh, tak ada masalah. Ataupun you boleh terus letakkan soalan tu dekat chat box dan nanti kita akan baca soalan tersebut dan saya akan try untuk jawab apa yang berkaitan. Right. Before we go into detail dengan neuroanatomy of the basal ganglia, right? Okay, I think kenapa topik yang ini saya tekankan because of ini adalah satu struktur pada brain yang mana kita jarang bercakap actually berkaitan dengan basal ganglia, right? And somehow but berkaitan dengan basal ganglia, actually kita ada banyak clinical importance untuk kita bincangkan, right? Okay? Especially bila kita bercakap mengenai satu disease yang sangat-sangat common untuk kita semua yang mana kita akan bercakap mengenai Parkinson disease, right? Tetapi dalam aspek neuroanatomy of basal ganglia tak banyak yang kita akan yang diperkatakan sebelum ini, right? So that's why hari ini saya terpanggil untuk bercakap mengenai in detail berkaitan dengan apa itu basal ganglia, right? And before kita bercakap mengenai basal ganglia, right, ini adalah satu case study yang mana by the end of this sessions, right, I think you boleh jawab something berkaitan dengan soalan, right? Okay, so kita ada satu case study yang saya buat berkaitan dengan satu patient which is complaining about he's having something like rapid and jerking involuntary movements which is involve upper limb and also lower limb, right? And this condition actually started about 6 months ago, and this disease actually is getting progressively worse. And the physicians actually made a diagnosis that this patient having satu condition which is we call as a Huntington chorea, right? Okay, so that's why by using the knowledge of neuroanatomy, right, we can explain about how this disease can involve the basal ganglia, right? Okay, that's why we need to explain the neuroanatomy of the basal ganglia and how we can relate to the disease yang berkaitan dengan basal ganglia, right? So some introduction kepada basal ganglia. What is basal ganglia actually? Basal means base. Ganglia refer to the cluster of cell body of the neurons, right? We call it as a ganglia, right? So basal ganglia actually refer kepada number of subcortical nuclei which is sitting inside the cerebrum, right? And this actually receives so many information from the cortex, cerebral cortex, especially it receives from the motor cortex, right? And also it can receive from the somatosensory cortex, right? And what is the role of the basal ganglia? Basal ganglia is very, very important untuk modulate and also untuk refine the cortical activity, right? Meaning that whatever movement, before we want to execute the movement, before kita nak produce certain movement, right? These are the role of basal ganglia to monitor, to modulate the movements before kita execute the movement, right? Okay? So it's something like, kita boleh katakan something like macam, it's a fine tuner untuk kita punya movement kita. You want to execute the movement, you mesti kena something like fine tuner untuk adjust your movement. Certain muscle contract and other certain muscle relax, right? Okay. So these are the role of basal ganglia. Okay. And before we talk in detail about basal ganglia, we need to explain about what is the functional classification of basal ganglia, and all these terms kita perlu sangat-sangat familiar bila kita bercakap mengenai basal ganglia. Kita banyak bercakap mengenai Parkinson disease, okay, which is in terms of intervention, in terms of rehab, right, in terms of exercise berkaitan dengan Parkinson patients, right, kita sangat-sangat familiar. Tapi when we talk about neuroanatomy, all these structure kita perlu explain, right? Number one is what is corpus striatum. Okay, actually lepas ni saya akan tunjuk gambar aja apa tu corpus striatum, but this slide hanya menunjukkan corpus striatum itu refer kepada apa. Actually, corpus stratum adalah nuclei, alright, which is referred kepada caudate nuclei dan juga lentiform nuclei, and we have another nuclei which we call as a lentiform nuclei, which is consists of putamen and also globus pallidus, which is globus pallidus we can divide into two. Kita ada globus pallidus externus and also we have globus pallidus internus. And also we have subthalamic nuclei, which is this is part of diencephalon. And also we have one structure which is derived from the midbrain, which is that structure basically known as a substantia nigra. Right. So these are the diagram, right? So we should very familiar with this diagram, right? Okay. So I have three diagrams over here. One is schematic diagram, and one is cadaver image. And so we have MRI image, right? Everything actually show the same structure, which is this is the sagittal sections of the brain. So at the base of the brain sagittal section, you can see clearly this is the mass of gray matter, right? The blue color over here, right? The blue color over the schematic diagram, the blue color, this is our lateral ventricles. Okay, the lateral ventricles, right? The CSF, right? The place where we can see the CSF, right? So the basal ganglia actually it's a gray matter. It's a piece of gray matter, especially sitting lateral to the lateral ventricles, right? So that's why when we observe lateral ventricles, laterally we can see this nuclei, the pink color nuclei, and this nuclei basically known as a basal ganglia, right? And the first nuclei that we notice are this nuclei, right, which is just lateral to lateral ventricles. This nuclei basically known as a caudate nuclei, okay, atau caudate nucleus, right? And just lateral to the caudate nucleus, we have this triangular shaped nuclei, gray matter, which is this nuclei known as a lentiform nucleus atau lentiform nuclei, which is consists of two parts. Laterally, we have putamen, and medially, we have globus pallidus, right? Okay, so you can label atau you can identify all the structure the cadaver image ini, same thing, right? Okay, so we can see here that this is the lateral ventricles. So lateral to lateral ventricles, we have caudate nucleus, and lateral to caudate nucleus, we have this triangular shaped nuclei, and this nuclei known as a lentiform nuclei, which is consists of laterally we have putamen, and medially we have globus pallidus, right? And in between this caudate nucleus and also the lentiform nucleus, right? So in between here, we have a bunch of axons ataupun white matter over here, which is very important. And this axon in between caudate nucleus and also lentiform nucleus, in between here, this bunch of axons atau white matter dikenali sebagai internal capsule, right? Internal capsule, which are running up and down dalam dia punya cerebral white matter. Okay, and also this MRI image, right? In anatomy, right? Not only we talk about gross anatomy, right? Not only we talk about neuroanatomy, right? And also we have one part which is we call as imaging anatomy. That's why this imaging anatomy is very important, right? That's why MRI image ini sangat clear where we can identify pada basal ganglia. And again, same thing, right? First, you can identify the lateral ventricles of the lateral ventricle of the brain. Just lateral to lateral ventricle over here. This is the gray matter, piece of gray matter known as a caudate nucleus atau caudate nuclei. And just lateral to caudate nucleus, right? This area, right? This area basically known as a lentiform nuclei ataupun lentiform nuclei ataupun lentiform nucleus, right? So and this is the basal ganglia actually sitting inside midbrain. Right, this is the midbrain. Actually, this is our brain stem, right? This is our brain stem. All right, we have medulla over here, and middle we have pons, and the most superior we have midbrain. There's one structure ataupun piece of gray matter sitting inside midbrain, ventral midbrain, and this piece of gray matter known as a substantia nigra. And substantia nigra is very important because of substantia nigra is very relevant untuk kita bercakap because of dia ada kaitan dengan Parkinson's. After this, saya akan bincangkan. Alright. Right. And before we go into details berkaitan dengan structure all the nuclei which is that belongs to basal ganglia, right? Membawa kepada 3D atlas anatomy which saya nak beritahu location exactly dekat mana terletaknya basal ganglia tersebut ataupun structure pada basal ganglia. Alright. Over here, all right? So this is the 3D atlas where, okay, this is the lateral view, right? Now I try to remove the superolateral surface of the cerebrum, all right? Now you can see clearly, right? Now you can see clearly. This is the internal surface of the brain. Okay, ataupun kita boleh katakan at the base of the brain. Basically, the blue color over here, this is lateral ventricles. Okay, this is the lateral ventricles over here. Consists of anterior horn, posterior horn, and also consists of inferior horn of the lateral ventricles. Okay, so this something like marking where we can observe the basal ganglia punya structure. Number one, apa yang kita boleh observe? The C shape, the comma shape gray matter over here ataupun nucleus. And this comma shape nucleus ataupun nuclei, these structures basically known as a caudate nucleus ataupun caudate nuclei, right? So this is the caudate nucleus, right? Over here, okay? Consists of three parts, consists of head of caudate nucleus, body of caudate nucleus, and so consists of tail of caudate nucleus, right? So this is caudate nucleus, okay? And this caudate nucleus is sangat-sangat significant untuk kita bercakap because dia membentuk floor dan juga membentuk roof untuk lateral ventricles, right? And when we observe laterally, right, this caudate nucleus actually it connect with another nucleus of the basal ganglia, and this nucleus of basal ganglia dikenali sebagai putamen, right? Dikenali sebagai putamen, right? Okay, laterally, okay, putamen, okay. So caudate nucleus and also putamen, right? Functionally, we call as a striatum, atau we call as a neostriatum. Okay, neostriatum. Now I try to remove this neostriatum. I try to remove this caudate nucleus, and so I try to remove this putamen. Okay, here, over here. So meaning that medially, right, we have another nuclei, bunch of nuclei atau cell body of neuron, right, inside the putamen. And this nuclei known as a globus pallidus. So we have two globus pallidus. One is globus pallidus laterally ataupun globus pallidus externus over here. And inside we have globus pallidus internus ataupun globus pallidus medial, right? Okay. So caudate nucleus, which is connect with putamen, right? Inside putamen we have globus pallidus lateral ataupun globus pallidus externus. And inside globus pallidus externus we have globus pallidus internus. Globus pallidus internus. All right. Okay. Okay. And all the structures basically, all these nuclei basically we call as a corpus striatum. Okay. And if I remove this globus pallidus internus, right? So what we can see inside here, so this is very big gray matter. Okay. Gray matter over here, and this gray matter, big gray matter over here sitting above the midbrain, and this structure basically known as a thalamus. Okay, thalamus. Okay. All right. Okay, now we talk about individual nuclei pada basal ganglia. Right now, first we talk about what is caudate nucleus. Right, caudate nucleus. Caudate nucleus actually refer to the C-shape mass of gray matter. Okay, saya dah tunjuk tadi, right? Bentuk ada C-shape of gray matter, which is dia sangat is very close, okay, intimately close with the structures of the lateral ventricles. Okay, that's why the caudate nucleus actually membentuk floor and also roof for the lateral ventricles. Okay, and it consists three parts: head, body, and also tail of caudate nucleus. Right, and this caudate nucleus actually connect with putamen over here. So caudate nucleus and also putamen collectively, these two structures known as a neostriatum atau dipanggil sebagai striatum. Alright. Second, we have lentiform nucleus. What is lentiform nucleus? Lentiform nucleus is a gray matter. It's a triangular shaped gray matter, right? And it's sitting lateral to the lateral ventricles, right? Okay, and also it's sitting lateral to the thalamus. Okay, it's a triangular shaped gray matter. And we have two parts over here. Laterally, we have putamen, right, which is connect into the caudate nucleus. And also medially, we have globus pallidus. And this globus pallidus, actually, we can subdivide into two areas lagi. Number one, we have globus pallidus externus over here, and also globus pallidus internus, right? Okay. So penting untuk kita tahu semua nuklei ni. It's very very important actually, because of every nuclei consists of different function and also different neural tracks ataupun different connections antara satu structure dan structure yang lain. That's why when we talk about the basal ganglia, you kena tahu every structure pada basal ganglia and how the connections happen antara one structure to another structure. Right. Okay, so I mentioned earlier di mana the globus pallidus consists of two parts. Laterally, we have globus pallidus externus, and also we have globus pallidus internus. And the most laterally, we have putamen, globus pallidus. Collectively, all these structures known as lentiform nuclei, together with caudate nucleus, all these structures basically kita panggil sebagai corpus striatum over here. Okay. Corpus striatum over here functionally consists of caudate nucleus and also lentiform nucleus. Whereas lentiform nucleus actually refer to putamens laterally, and also medially we have globus pallidus. And globus pallidus actually we can divide into two areas lagi. We have globus pallidus externus and also globus pallidus internus. Alright. Alright. Again, if you have any questions, you just open mic dan boleh tanyalah soalan. Okay. Alright. Next, we talk about another piece of gray matter. But now this gray matter actually is bukan belongs to cerebrum, ataupun dia bukan belongs to tongue and subfrontal structure, tetapi dia belongs to brainstem, ataupun specifically dia adalah belongs to midbrain structure. And this piece of gray matter dikenali sebagai substantia nigra. Substantia means substance, nigra means black, meaning that this piece of gray matter, kalau you tengok color dia is very dark in color. Right? Because it consists many neuromelanin punya pigment, right? Neuromelanin pigment sitting inside this gray matter, right? That's why they're dark in color. And it's a large motor nucleus actually. It's a large motor nucleus in the midbrain, okay? Ventral midbrain, okay? We talk about substantia nigra. And this substantia nigra actually consists of two parts. Anteriorly over here, dikenali sebagai substantia nigra pars reticularis, and posteriorly, the dark color over here, and this is what we call as a substantia pars compacta. Pars compacta. When we talk about Parkinson's disease, right? Okay, I think you need to remember about this structure because of Parkinson's disease actually refer to this Parkinson's disease actually is related to the lesions of the substantia nigra pars compacta. Right? Okay. Now you understood that the exactly structures which is related to the Parkinson's actually refer kepada substantia nigra. Lebih tepat lagi, substantia nigra pars compacta. Alright? Yang mana this substantia nigra pars compacta actually consists of dopaminergic fiber. They consist of neuron, which is basically this neuron basically produce and secrete dopamine to the striatal neuron. Okay. That's why this neuron are like we call it as a dopaminergic neuron, and the fiber which is running through this from the substantia nigra and extend towards the striatum, and that fiber which is carry the dopamine go to the striatal neuron dipanggil sebagai nigrostriatal fibers. Okay, nigrostriatal fiber. That's why when you want to explain about Parkinson's disease, whatever, right, you need to talk about substantia nigra pars compacta. You need to talk about what is nigrostriatal fiber. Okay. So again, these are the schematic diagram to show you, right? This is the substantia nigra, okay, which is sitting ventral to the midbrain. Okay, ventral to the midbrain consists of two areas. Anteriorly, pars reticularis. Posteriorly, we have pars compacta. Right. Now, just briefly about what is the connections of the corpus striatum, or what is the connection of the basal ganglia, right? Okay? Because of this basal ganglia, you must have certain input from the cortex, and also you must have output back into your cortex. That's why when we talk about basal ganglia, ataupun kalau kita bercakap mengenai any neuro, right? Any neuro punya structure, whatever, okay? Kita perlu bercakap mengenai circuit, ataupun kita akan bercakap mengenai tracks, atau kita akan bercakap mengenai connections. Dan itu menyebabkan kenapa neuro ini tak ramai orang suka actually, right? Okay? Because it involves so many tracks. Tracks means bundle of axons, right? Okay? So in this case, right, when we talk about corpus striatum, ataupun when we talk about basal ganglia, right, we have efferent connection. Efferent means the fiber coming from where? It receives input from where? Number one, right? at least you can explain about corticostriatal fiber. What is corticostriatal fiber? Corticostriatal fiber is a fiber which is coming from the cortex. Okay, coming from the cortex. It's coming from the motor cortex. It's coming from the primary motor area. It's coming from the premotor area. So last lecture, last sharing session, saya explain benda tu semua. It's coming from the supplementary motor area and also it's coming from the somatosensory area. All this input from this cerebral cortex actually basically sent into the corpus striatum ataupun sent into striatum. And this fiber of the neuron, okay, dikenali sebagai corticostriatal fiber, and it's a glutaminergic fiber which is they produce glutamate neurotransmitter, right? And also we have one fiber lagi yang dikenali sebagai nigrostriatal fiber. Nigrostriatal fiber, which is this fiber where it coming from the substantia nigra. It coming from substantia nigra, and it carry dopamine, and it secrete dopamine pada kita punya striatal neuron atau striatal basal ganglia. And this structure atau this fiber dikenali sebagai nigrostriatal fiber, which is this nigrostriatal fiber adalah consists of dopaminergic fiber, which it produce and secrete dopamine to the striatal neurons. Okay. Number two, we have efferent fiber, right? Okay, which is input from the basal ganglia go into certain area of the brain by this stripe atau by this fiber, right? So the efferent fiber from the corpus striatum, we have many tracks. Saya just choose yang paling relevant sekali. Number one, we talk about what is striatoplasmal fiber. Striatoplasmal fiber adalah refer kepada bundle of axons which is connect in between putamen ataupun caudate nucleus dan juga globus pallidus, sama ada external ataupun internal. And this bundle of axon in between these two areas, right, dikenali sebagai striatoplasmal fibers, right? Number two, we have thalamic fasciculus. Thalamic fasciculus actually refer kepada bundle of axon, which these connections happen in between our globus pallidus and also dengan kita punya globus pallidus dan juga kita punya thalamus, right? Okay, because kita perlu ingat, everything information daripada basal ganglia, everything akan send back into our cortex through thalamus, right? Okay, so that's a connection antara basal ganglia dan juga thalamus by these tracks. These tracks dikenali sebagai thalamic fasciculus, which is consists of two different tracks. Number one, kita bercakap mengenai fasciculus lenticularis, okay, fasciculus lenticularis over here, and also number two, kita bercakap mengenai what is ansa lenticularis. But generally, ansa lenticularis and also fasciculus lenticularis, these two tracks actually connect in between globus pallidus and also thalamus, and collectively all these tracks dipanggil sebagai thalamic fasciculus, right? And number two, we have subthalamic fasciculus. Subthalamic fasciculus ada connections antara globus pallidus externus dan juga subthalamic nucleus. Okay, subthalamic nucleus. And this connection antara these two structures dipanggil sebagai subthalamic fasciculus. Right. And yes, this is very, very important. Right? Okay, this is very, very important. If you want to explain about any lesion atau any clinical manifestations berkaitan dengan basal ganglia, kita perlu bercakap mengenai apakah connection pada basal ganglia yang mempunyai two pathway. And number one, we talk about what is direct pathway, and number two, what is indirect pathway, right? Direct pathway dan indirect pathway, right? Before kita pergi in detail berkaitan dengan basal ganglia connection, which is kita bercakap mengenai direct pathway dan indirect pathway, ada soalan ke semua? Ada soalan ke? Atau saya terlampau cepat? Ada dekat chat box ada? Tak ada. Okay, saya continue. Alright. What is direct pathway basal ganglia? Direct pathway basal ganglia basically it is something like circuit, neural circuit connect. It connect between four structures. Okay, number one over here, this is our cerebral cortex, which is referred to our motor cortex, primary motor area, premotor area, our supplementary motor area, and also our somatosensory area of cerebral cortex. Okay. Number two, we talk about striatum. What is striatum? Striatum actually refer to the putamen and also caudate nucleus. And number three, we talk about what is GPI. GPI refer to globus pallidus internus, and last one refer to the thalamus by this nuclei VA and VL. VA stand for ventral anterior nuclei and VL stand for ventral lateral nuclei of the thalamus, right? So this circuit actually connect in between cerebral cortex, striatum, globus pallidus, and so thalamus, and this circuit we call as a direct pathway ataupun direct loops of basal ganglia. Generally, we can say that this direct pathway is responsible untuk increase motor activity of the cortex, increase motor activity of the cerebral cortex. So whatever input which is coming from the thalamus, actually this input from thalamus basically akan stimulate our cortex to increase dia punya activity, motor activity atau pergerakan dia, right? Whereas when we talk about indirect pathway, right, we have extra structure here, right? Not only we have cortex, not only we have striatum over here, but it involves globus pallidus externus. It also involves subthalamic nucleus, and it also involves globus pallidus internus, and it involves thalamus by ventral anterior and also ventral lateral nuclei and send back into our cortex. So meaning that it involves another nuclei of here. That nuclei dipanggil sebagai substantia nigra. Dikenali sebagai subthalamic nuclei. Okay, subthalamic nuclei and also globus pallidus externus. Because of kita ada involvement of the subthalamic nucleus, right? That's why this pathway dikenali indirect pathway, meaning that kita stimulate cortex indirectly through subthalamic nucleus, okay, atau subthalamic nuclei. Generally kita boleh katakan this indirect pathway is very important untuk inhibit ataupun to decrease motor activity of the cortex, mengurangkan pergerakan pada cortex. Whereas direct pathway increase motor activity, indirect pathway decrease motor activity ataupun inhibit motor activity of the cortex by thalamus. Okay. Right. Now we talk about blood supply. Because of many lesions of the basal ganglia actually related to the masalah-masalah berkaitan dengan cerebrovascular problem, right? Kita bercakap mengenai masalah-masalah berkaitan dengan stroke atau berkaitan dengan infarctions of the basal ganglia, which is that's why this is very important knowledge berkaitan dengan we need to explain about apakah blood supply pada basal ganglia, right? Number one, basal ganglia actually is a deep structure of the brain and it receives deep artery, okay, deep artery. First artery which is supply our basal ganglia adalah coming from where? Coming from MCA, and as you know, the most common artery which is most of the stroke cases ataupun berkaitan dengan intracerebral hemorrhage, right? The most arteries yang involved atau occlusions yang biasa berlaku adalah MCA, which is kita panggil sebagai middle cerebral artery. Pada middle cerebral artery, the first segment of middle cerebral artery atau kita panggil sebagai M1 segment of MCA, terdapat one very small artery, deep artery, which is supply to our basal ganglia, and this artery dikenali sebagai lenticulostriatal artery, lenticulostriatal artery ataupun lateral striatal artery. So this lenticulostriatal artery ataupun lateral striatal artery actually it derives from M1 segment of the MCA, and it supply most of the structures of the basal ganglia, okay, laterally mostly. And also we have another artery which is coming from where? It coming from ACA, anterior cerebral artery over here. ACA, it coming from ACA, right? And this artery usually supply anterior and also it supply medial surface of the basal ganglia. And this artery adalah branch from ACA, and this artery dikenali sebagai recurrent artery of Hübner. Okay, recurrent artery of Hübner. That's why bila kita bercakap mengenai blood supply of the basal ganglia, only two artery yang supply. Number one, lenticulostriatal artery. Number two, recurrent artery of Hübner yang supply pada basal ganglia laterally and also medially. Right. Now, this is the general function of corpus striatum atau basal ganglia, right? Okay. Basal ganglia bukan macam kita punya motor cortex pada brain. Motor cortex ataupun cerebral cortex, basically when kita stimulate cerebral cortex, apa yang berlaku is kita akan straight away produce movement. Itu peranan atau fungsi kita punya cerebral cortex ataupun motor cortex pada kita punya cerebrum. Basal ganglia bukan macam itu. Basal ganglia macam saya berkata tadi, it involve berkaitan dengan fine tuner. It penting untuk modulate. Penting untuk modulate kita punya motor activity kita. So meaning that it's very important untuk mediate autonomic activity which is involved untuk normal motor function. Dan ini kita boleh bayangkan di mana how kita swing our arm during kita berjalan, right? Okay. Dan juga kita the movement our leg, right? Everything akan become autonomic tanpa kita sedar. And everything basically designed by basal ganglia, right? And also it's very important untuk help smoothing and also the voluntary motor activity. Dan ini banyak berlaku actually, right? Okay? Kan yang mana I think the best example di mana bila kita melakukan satu activity, right? For example, kalau you nak comb your hair, right? You nak sikat rambut, for example, right? Okay? So it involves multiple joint organ. It involves your wrist, it involves your IP joint, it involves your elbow, it involves your shoulder, right? Meaning that if you want to comb your hair, right? So nampak tak? Your wrist akan mengalami radial deviations, your elbow akan mengalami flexions, your shoulder akan mengalami external rotation dan juga abductions. Okay, meaning that you are something like sequence of movement yang mana everything planned by basal ganglia, right? Planned by basal ganglia, right? Okay, so that's why we can say that corpus striatum atau basal ganglia is very important untuk help smoothing the voluntary motor activity, right? Okay, and also absolutely this is very important. Corpus striatum juga penting untuk maintain our muscle tone. That's why when we talk about lesion of basal ganglia, right, one of the clinical manifestation ataupun presentation dekat patient yang you boleh nampak adalah di mana patient akan produce abnormal muscle tone. Kemungkinan dia akan produce hypotonia ataupun dystonia, abnormal muscle tone, right? Okay, and also this corpus striatum also not only penting untuk motor planning, right, atau movement planning, dia juga penting untuk prevent any involuntary movement. For example, if you want to hold certain object macam ni, right? Okay, so apa yang berlaku? You just produce flexion pada you punya finger sahaja macam ni, right? Okay, so you don't want to move your wrist, right? Okay, you just hold your pen macam ni, right? So meaning that your wrist, your elbow, everything perlu stand still, tidak bergerak. Because kita perlu gerakkan IP joint. Meaning that you tak perlu gerakkan your wrist, you tak perlu gerakkan you punya elbow, gerakkan you punya shoulder. Meaning that, right, itu peranan basal ganglia. That's why bila basal ganglia ada lesion atau ada mengalami injuries, right, apa yang berlaku patient? Patient akan tend untuk gerakkan joint-joint yang tak ada kaitan. Yang mana itu menyebabkan ada movement disorder berlaku lah after that, right? Okay? Yang kita panggil sebagai chorea atau Ballis movement atau artetosis, right? Okay? Semua itu adalah pergerakan-pergerakan yang purposeless, involuntary dan tak sepatutnya berlaku. Tetapi itu berlaku because of lesion berlaku pada corpus striatum, lesion berlaku pada basal ganglia. That's why fungsi utama basal ganglia adalah penting untuk prevent any unwanted movement ataupun involuntary movement yang lain, right? Okay? So itu adalah fungsi basal ganglia. Right. Now we talk about basal ganglia disorder. Apa lesion yang boleh berkaitan yang berlaku pada basal ganglia, right? Kita understood about neuroanatomy of basal ganglia. We understood about the circuit pada basal ganglia, which consists of direct pathway and also indirect pathway. Direct pathway to increase motor activity, indirect pathway to decrease motor activity. Now we talk about apa lesion atau injury yang boleh berlaku pada basal ganglia. Usually when we talk about basal ganglia disorder, kita boleh divide into two syndrome ataupun genesis. Alright, we talk about what is hypokinesia syndrome and what is hyperkinesia syndrome. Hypokinesia means less movement yang berlaku, kurang pergerakan yang berlaku. Hyperkinesia berlaku because of excessive unwanted movement berlaku, terlebih pergerakan yang berlaku, right? Okay, so we have two types of syndrome berkaitan dengan basal ganglia disorder, right? I think this is the classic example, the best example when we talk about basal ganglia disorder. I think kita ada pengalaman, right? Kita ada pengalaman atau kita ada knowledge berkaitan dengan Parkinson's. Okay, Parkinson adalah hypokinesia syndromes. Okay, Parkinson adalah hypokinesia syndrome. Nanti asal saya percaya kebanyakan kita pernah deal dengan patient yang berkaitan dengan Parkinson atau tahu berkaitan dengan what is Parkinson's actually. Right. Parkinson, again saya ulang balik, dia merupakan hypokinesia syndrome which is berkaitan dengan lesions yang berlaku pada substantia nigra pars compacta. Okay? So ulang semula, dia berkaitan dengan lesions atau injury yang berkaitan dengan substantia nigra pars compacta. Okay? Pars compacta. Ini merupakan something like neurodegenerative disorder, yang mana neuron pada substantia nigra pars compacta pasti suddenly die atau suddenly mengalami atrophy. Suddenly dia suddenly dia dissipate, mati, hilang macam tu saja, okay? So let's say 60%, 70% of this neuron basically atrophy, lesion berlaku pada substantia nigra. So ini menyebabkan patient akan start untuk develop pergerakan-pergerakan yang mana that pergerakan akan menjadi sangat slow, right? And this kind of symptom atau this kind of clinical presentation kita panggil sebagai bradykinesia. Patient akan menghasilkan pergerakan yang very slow, pergerakan yang slow. Atau akinesia, yang mana pergerakan itu adalah slow, yang mana atau kita boleh katakan patient susah untuk initiate the movement, susah untuk menghasilkan pergerakan, initiate the movement. Okay, so we can say that patient dia akan menunjukkan bradykinesia, slow movement, ataupun akinesia. Okay, problem in terms of to initiate the movement class. Okay, alright. Number 2 is we talk about resting tremors. Okay, pun juga boleh berlaku. Okay, resting tremor. And before that, saya pun nak bercakap, lesion of substantia nigra pars compacta ini berkaitan dengan lesion yang memberikan efek pada direct pathway. Okay, direct pathway. Okay, ataupun dia memberikan efek pada kita punya nigrostriatal pathway atau nigrostriatal fiber pada direct pathway. Right, dan menyebabkan patient akan produce bradykinesia atau akinesia. Right? Okay. Number 2 is resting tremors. Okay. Resting tremors adalah again one of the clinical presentations of the Parkinson disease, di mana patient alternately contraction berlaku pada dia punya limbs, especially dekat dia punya hand lah. Right? So this is berlaku because of this is alternate contraction yang berlaku pada agonist muscles dan juga antagonist muscles. Okay, agonist dan antagonist muscle. Okay, and why this is happen actually? Okay. Okay, actually a lot of hypotheses to explain about resting tremors, right? But I think the most concrete hypothesis adalah di mana imbalance di antara acetylcholine dan juga dopamine dekat kita punya striatal neuron menyebabkan berlakunya resting tremors. Okay, menyebabkan resting tremor yang mana agonist muscle contract and same time antagonist muscle also contract. So ini menyebabkan why patient akan produce resting tremors. Okay. Yang ketiga is patient akan produce hypotonia atau kita panggil sebagai rigidity, right? Okay? So rigidity untuk Parkinson basically we can call as a lead pipe rigidity, di mana if this patient produce rigidity, di mana it's very smooth and consistent rigidity, right? Kalau you move the limb passive secara pasif pada patient, right? And the rigidity basically very smooth and also consistent. And this kind of rigidity kita panggil sebagai lead pipe rigidity. Ataupun kalau kita try untuk berikan force pada dia punya limbs and you try untuk pasif pergerakan pada dia punya limbs, dan you akan rasa macam ada something like jerky movement, right? So this kind of rigidity basically kita panggil sebagai cogwheel rigidity. Okay, so rigidity actually refer kepada hypertonia. Okay, hypertonia of the muscles. Okay. And also the last one is berkaitan dengan postural instability. And postural instability actually, again, basically involve in posture. Okay, how we can maintain our posture? Basically, it involve our basal ganglia and also it involve our cerebellum. Okay, that's why when we have lesion pada substantia nigra pars compacta, okay, ini menyebabkan patient akan produce postural instability. Right, patient akan start untuk ada stoop posture, right? Badan dia stoop, membongkok ke depan, right? Okay, and then dia punya arm swings ketika berjalan akan reduce, kan? Dia akan reduce arm swing, and also dia punya step ketika walking akan become small and small and small, right? Okay, so itu adalah berkaitan dengan posture instability. Okay, stoop posture, right? Okay, reduce arm swing and also reduce dia punya step dia ketika walking, right? Okay, itu adalah berkaitan dengan postural instability, right? Okay. So, so again, this is MRI image to show you, right? What's the pictures of the basal ganglia pada Parkinson punya patient? Okay. So what you can see here, this is the MRI image untuk midbrain. Okay. These are the superior view of the midbrain, right? This is anterior part and this is the posterior part. And anterior part, we can see the dark color over here. The dark color over here basically refer to the substantia nigra pars compacta. Okay, substantia nigra pars compacta, right? If you notice over here on the left side, right? Okay, so what you can see here, you can say at the posterior 1/3 of the substantia nigra pars compacta, you can see something like it bifurcate into two, right? You nampak macam dia bercabang dua, right? Okay, so this kind of sign kita panggil sebagai swallow tail sign. Swallow tail sign. This is normal for human being. For those yang tak ada Parkinson, basically, right? You can nampak this kind of sign pada midbrain atau pada substantia nigra, right? Tetapi kebanyakan patient Parkinson's, basically, right? When we view MRI, okay, kita view the midbrain substantia nigra pars compacta, right? Basically, this swallow tail sign basically disappeared, hilang ataupun absence, right? Okay? So itu indicate this is one of the diagnosis, right? Ataupun cara how we can diagnose Parkinson disease melalui structure pada substantia nigra pars compacta melalui MRI punya image. Okay? So we know that if you have swallow tail sign, this is normal. If you don't have swallow tail sign, for example on the right side over here, right? So kita tahu ini adalah berlaku pada Parkinson patients. Okay. Alright, itu adalah hypokinesia syndrome. Okay, when we talk about Parkinson disease. Right. Now we talk about hyperkinesia syndrome, right? Hyperkinesia syndrome. Okay. So hyperkinesia syndrome adalah berlaku because of it. What hyperkinesia? Hyperkinesia syndrome adalah berkaitan dengan this patient akan produce involuntary, unwanted, excessive movement actually. Okay, pergerakan-pergerakan yang terlebih dan pergerakan adalah purposeless, tidak berfungsi pergerakan tersebut. Okay, so we have multiple abnormal movement berkaitan dengan hyperkinesia, iaitu kita ada chorea movement, okay, we have arteriotosis movement, hemibalism atau hemibalisma, right? We have dystonia and also we have tardive dyskinesia. Everything adalah abnormal movements berkaitan dengan hyperkinesia. Right. And I think the most common abnormal hyperkinesia punya movement adalah berkaitan dengan chorea. What is chorea? Chorea adalah refer kepada dance. Chorea bermaksud dance actually. Okay. Chorea adalah refer kepada involuntary movement and usually affect kita punya distal limbs. It's a brief and non-rhythm punya movement and it's abrupt and seems to flow from one body part to another body part. Okay. So you can see over here again, okay, this patient pada these kids actually, okay, you can see that the movement actually affect the lower limb there, right? Okay? Affect the lower limb there, okay? Can you see again? Which is meaning that from the movement actually affect produce from one part to another part. Okay? For example, here you can see it from the ankle and then move into the knee and move into the hip, right? And it's continuous. Okay? So this kind of movement kita panggil sebagai chorea, and that movement basically is jerky. Dia pergerakan itu adalah jerk movement, okay? So we know that ini adalah chorea movement actually, okay? And why chorea movement boleh berlaku? Why this chorea boleh berlaku? Chorea berlaku because of lesion pada caudate nucleus dan juga putamen. Okay, ataupun neostriatum punya lesions lah. Okay, lesion pada neostriatum yang mana untuk menghasilkan chorea ini, right? Certain disease boleh berlaku. For example, I think one of the genetic disorder which is kita panggil sebagai Huntington's disease atau Huntington's chorea. Huntington's adalah genetic disorder yang mana this effect kita punya neostriatum neuron, di mana Huntington's adalah refer kepada genetic disorder yang mana dia merupakan berlaku pada kromosom number 4, right? Yang mana dia akan menghasilkan trinucleotide replications of the CAG nucleotide, right? CAG nucleotide yang mana dia akan menghasilkan protein yang toxin, and that protein kita panggil sebagai Huntington proteins. Yang mana this protein actually akan very toxic and it can kill ataupun menyebabkan neuron-neuron pada caudate nucleus ataupun putamen akan slowly mengalami atrophy. Okay, atrophy, right? Okay, so itu adalah Huntington chorea, right? Ataupun juga chorea juga boleh berlaku pada kids, mostly pada kids. Yang mana this chorea dipanggil sebagai Sydenham's chorea ataupun kita panggil sebagai Saint Vitus dance chorea. Saint Vitus dance chorea. Usually ini berlaku pada kids, kanak-kanak, yang mana kanak-kanak yang ada masalah rheumatic fever ataupun rheumatic fever adalah fever yang berlaku because of infection pada streptococcus infections, yang mana badan akan produce antibody, but this antibody basically akan attack our own tissue. And one of the favorite tissue this antibody attack adalah dia akan attack our striatum neurons ataupun it attack our caudate nucleus ataupun putamen, right? Okay, but tetapi dia bukan permanent punya chorea. Dia after the infections subside, hilang, and this chorea akan slowly dissipate, akan hilang lah. Okay, so itu adalah kita panggil sebagai Sydenham's chorea ataupun we call as a St. Vitus-Dance chorea, right? Dan juga this chorea juga boleh berlaku pada Wilson disease. Wilson disease adalah masalah kita panggil sebagai it's a hepatolenticular disease. Di mana ini adalah masalah di mana berlakunya masalah dari segi metabolism copper ataupun cuprum, right? Okay? Yang mana there are so many cuprum basically deposit dekat kita punya liver, and this cuprum juga once enter our bloodstream dia mudah termendap dekat kita punya brain tissue. And one of the area where this copper mudah terbendap adalah dekat striatum. Okay, dekat striatum. Okay. Selain itu dia juga akan deposit dekat kita punya cornea, right? Dekat kita punya liver and so many places, right? Tetapi yang antara kawasan yang paling mudah untuk mengalami deposition adalah dekat bahagian striatal neuron. Because once copper deposit dekat striatal neuron atau striatum area, right? So this copper akan memberikan toxic, it's toxic substance actually, right? Okay? And apa yang berlaku that neuron akan die dekat that area lah. Okay, yang menyebabkan why patient akan develop this kind of symptom atau this kind of clinical presentation. Okay, right. So ini adalah schematic diagram to show you, right? Okay, antara normal brain and also patient yang ada Huntington disease brain. Okay, the first one is we have this healthy striatum. Okay, we have a healthy striatum over here, right? And medially we have these lateral ventricles. And the other side over here, right? We have atrophy of the striatum, meaning this striatum basically die. Okay, maybe it's due to Huntington, and maybe it's due to Sydenham's chorea, or maybe it's due to Wilson disease, or maybe it's due to infections. Okay, infection. Okay. So apa yang kita notice dekat this area adalah di mana when you have atrophy of the striatum area, right? The lateral ventricles over here akan become enlarged atau akan become dilated. Okay, these are one of the diagnosis untuk this kind of disease yang mana kita akan lihat dekat mana lateral ventricles itu berlaku lah ataupun dekat mana enlargement lateral ventricle itu berlaku. Okay, so again this is the MRI image di mana we can see clearly berlakunya dilated ataupun enlargements of the lateral ventricles. Why does this happen? Because of atrophy of the striatum. Should be the area over here. This area adalah area di mana you can see the striatal neuron. You can see the caudate nucleus and so you can see the putamen. But suddenly that neuron die yang menyebabkan why the lateral ventricle akan become enlarged, right? Okay. So this kind of clinical presentations kita panggil sebagai chorea. Alright, chorea. Second, we have hemibellismus. Okay, this is more dramatic neurological syndrome actually. Okay, it's more severe, more dramatic compared to chorea actually. Okay, and it's very wild, it's violent movement, it's high amplitude flinging, and also purposeless movement. Usually affect contralateral limbs. Okay, which is the other side. Okay, and usually the hemibellismus actually involve proximal limb. That's why they can produce very violent movement. Okay, usually they can affect kita punya proximal limbs. Proximal upper limb, usually kita punya shoulder girdle, atau dekat affect kita punya lower limb, ataupun lebih tepat lagi, mostly dekat affect kita punya pelvic girdle punya muscles. Okay, so generally we can say it involves proximal limbs punya muscles. Okay, why hemibellismus berlaku? Because this is lesion pada one of the indirect pathway in nuclei. Okay, one of the indirect nuclei, yang mana that nuclei dikenali sebagai subthalamic nuclei. Okay, that nuclei dikenali sebagai subthalamic nuclei. Okay, sekejap. Okay, alright. Okay. So here subthalamic nuclei actually, right, is one of the nuclei which is belong to basal ganglia sitting below to your thalamus. Okay, and it's a diencephalic origins lah, that belongs to diencephalon. Okay, subthalamic nuclei. So lesion pada subthalamic nuclei akan produce hemibellismus punya criteria. Okay, so you can see these are the diagram. So these are the pictures ataupun image berkaitan dengan what's hemibellismus actually. Okay, so you can see the movement basically is very violent, right? It's very, very violent, okay? And it affects mostly our pelvic girdle ataupun shoulder girdle. And next abnormal movement yang berlaku if you have lesion pada basal ganglia actually affect kita punya indirect pathway adalah, alright, ada banyak lagi, okay? First is we talk about arteriotosis. Okay, arteriotosis is almost similar to the chorea. Okay, it's almost similar to the chorea, but the movement basically is very smooth and rhythmic. If you have something like a rhythm, and usually affect kita punya distal limb. Okay, it's very smooth and ada the rhythm pada kita punya distal limb. Okay, it's very smooth and rhythm, and it's something like something like just spinning movement pada bahagian distal limb, right? Okay. So this kind of movement dipanggil sebagai arteriotosis, and usually arteriotosis adalah berkait rapat dengan lesion pada putamen. Okay, lesion pada putamen, right? And next we have lesion pada same thing pada striatal neuron, yang mana this neuron, this lesion dikenali ataupun this clinical presentation dikenali sebagai dystonia. Okay, this is the abnormal muscle tone actually, dystonia, increased muscle tone. Okay, increased muscle tone ataupun sustain of muscle contractions menyebabkan you can produce dystonia. Okay, so in this picture we can see here, okay, these are the dystonia which is berlaku pada cervical spine. Okay, we call it as a cervical dystonia atau we call it as a torticollis. Okay, torticollis, right? And the last one is berkaitan dengan tardive dyskinesia. Okay, again abnormal movement, and tardive dyskinesia actually berlaku pada banyak patients yang ada masalah neuropsychiatric disorder. Contohnya patient yang ada masalah schizophrenia. Why ini berlaku? Because patient yang ada masalah macam neuropsychiatric disorder ataupun schizophrenia, basically dia akan prescribe ubat antipsychotic drugs, right? Dia akan ambil antipsychotic drugs ataupun dia akan ambil dopamine antagonist drugs dengan terlampau lama. It's a prolong dia akan ambil, right? Okay? Yang mana bila prolong dia ambil this kind of medications, itu menyebabkan patient akan start untuk develop abnormal movement. Okay, yang mana this kind of abnormal movement dikenali sebagai tardive dyskinesia. Okay, you can say that ada perubahan dari segi dia punya facial expressions, okay, ataupun dia punya tongue dia, right? Usually they affect dia punya lip dan juga dia punya facial expression muscles. Okay, you can see that dia punya tongue dia, right? It's something like macam flying catching movement. Okay, flying catching movement, right? Okay, dia always tongue dia macam bergerak dan tak boleh kawal, right? Okay, so ini adalah because of prolonged taking antipsychotic drugs especially pada patient yang ada masalah neuropsychiatric disorder. Okay, ini adalah side effect dia yang mana kita panggil sebagai tardive dyskinesia, right? Okay. Okay. I think that's all berkaitan dengan sharing session untuk hari ini, right? Okay. So because saya percaya di mana ada banyak soal jawab yang kita akan berlaku after this, right? That's why I think this sharing session is very, very short. Saya hanya bercakap mengenai satu structure saja pada brain, which is basal ganglia, dan apa lesion ataupun clinical presentation yang boleh berlaku pada this kind of structure lah. Okay. So habis untuk sharing sessions, saya buka untuk sesi Q&A. Ada soalan? Ataupun boleh tulis dekat chat. Okay. Ada persoalan? Chat box ada? Tak ada. So, ataupun anything audience ataupun participant yang nak share berkaitan dengan this structure basal ganglia ataupun ada experience berkaitan dengan basal ganglia, anything boleh share, right? Because I think basal ganglia, what saya pilih tadi saya beritahu adalah satu structure yang sangat jarang kita bercakap lah mengenai basal ganglia, right? Okay, but somehow it's very, very important. Okay, that's why saya perlu explain, perlu share all this information so that you can kaitkan dengan clinical punya setting nantilah. Okay, when you go to the when you trying to treat ataupun you ada any you deal with any Parkinson's disease atau any patient yang ada masalah hyper atau hypokinesia, right? Okay, so maybe you can relate with this kind of knowledge lah. right? Okay, that's why yes, it's something like compulsory untuk all of you untuk explain in detail berkaitan dengan what is basal ganglia punya structure, right? Okay. Yes, any questions so far?
Cik Mizan.
Yes. Yeah, formality. Yeah, formality.
It's okay. I just want to ask you something regarding maybe when we are doing a certain movement,
Yes.
how does basal ganglia control that movement?
Okay. All right. Okay, fine. All right. Okay, macam ni, Bang. Okay? Actually, when we talk about motor planning, right? Motor planning, the idea is something like that one, right? Okay, when you want to produce movement, right? Okay, everything coming from your idea, right? Okay, that's why idea coming from where? Our prefrontal cortex first, and that idea basically transfer into our motor area of our cerebral cortex. It transfer into our premotor area. It transfer into our supplementary motor area, and all this idea, actually, all this input basically before we execute the movement, all the information basically filtered by basal ganglia. Okay, filter by basal ganglia. For example, from here, from cortex, the input go into basal ganglia, or the basal ganglia basically filter the movement through direct pathway and also indirect pathway, and back into thalamus and send back into our cortex, and it stimulate our upper upper motor neurons, which is it stimulate our corticospinal tracts, and so it stimulate our corticonuclear tracts. Okay, because of our motor cortex, our primary motor area, basically the function basically only execute the movement through two tracks, which is number one, we talk about corticospinal tracts. We talk about number two, we talk about bulbar tract atau corticonuclear tract. But in order to feeding this corticonuclear atau corticobulbar tracts ataupun corticospinal tract, siapa yang feeding the information, the right information? Actually, the basal ganglia yang akan feeding all these informations, right? Just as I said tadi, basal ganglia consists of neuron, which it produce two neural circuit yang kita panggil sebagai direct pathway and also indirect pathway. Direct pathway, usually kita bercakap mengenai this direct pathway, when we stimulate direct pathway, it can increase motor activity of the cerebral cortex. Okay? It increase motor activity. Whereas the indirect pathway, kerja dia, right, when we stimulate this indirect pathway, usually it can inhibit the motor activity, right, ataupun it can decrease the motor activity, right? Okay, so itu adalah fungsi basal ganglia, and also this basal ganglia also it basically controlled by another structure pada membrane yang kita panggil sebagai substantia nigra. Okay, substantia nigra. That's why substantia nigra and also our striatum, actually these two is very important untuk control, untuk modulate, untuk facilitate, untuk coordinate our muscle contraction. Yang menyebabkan why certain muscle contracts and why certain muscle relax. Why our muscle consists of muscle tone. Okay, consists of muscle tone. Why we can produce satu sequence of movement, right? Okay, which is involved so many joints over here, right? Okay, why this joint, for example, flex, why this joint suddenly extend, why this rotate, everything. Every movement ini basically monitored by basal ganglia, involuntary dan unconsciously one, actually. Yes, one.
Thank you, Cik Mizan. Very well explained.
Yes, one. Right, okay. Role of basal ganglia, actually clearly we can see, all right, when we talk about clinical presentations there, right? So every nuclei, right, why we know this nuclei, what is the function for each nuclei, basically we refer to the clinical presentations, okay? Okay, clinical presentation, okay? So from clinical presentation, we come up with this idea, all right, okay? For example, if you have lesion pada basal ganglia, all right, patient can produce hypertonia. So meaning that, kita assume that, all right, meaning that this basal ganglia can basically control our muscle tone, right? And if you have lesion pada basal ganglia, patient akan problem hypo atau hyperkinesia, okay? So that's why we jump into conclusion, all right, meaning that the basal ganglia basically penting untuk initiate and also terminate our movement. Atau it's very important to coordinate our muscle contraction, yang menyebabkan kenapa term motor planning itu wujud, motor planning. Okay, all this motor planning, why certain muscle contract, why certain muscle relax, why we have muscle tone, right? Everything basically filter and basically everything is under control by basal ganglia. Ataupun dalam bahasa mudah kita boleh katakan this basal ganglia something like QC untuk our movement, quality control untuk our movement. Right, okay? The final product, basically everything akan received by our cortex, okay, which is by corticospinal tract and also corticobulbar tracts. If this corticospinal tracts and so corticobulbar tract receive wrong information daripada basal ganglia, meaning that you can produce wrong movement. Sama ada hypo ataupun hyperkinesia punya movement you can produce. Right? Hope everything clear. Okay.
Very clear.
Okay, very good, Puan. Okay, thank you, Puan. Okay, so any questions?
Okay, Cik Rizal, sekarang ni kita ada
Alright.
raising hand daripada Tuan ataupun Cik 583 HSN.
Okay,
So,
alright.
Tuan ataupun Cik boleh buka mic dan juga ataupun gunakan chat box untuk ajukan soalan.
Boleh.
Seterusnya kita ada soalan melalui chat box daripada Puan Zuraidah Muhammad.
Okay.
Okay, so soalannya, Tourette syndrome, does it have any relation with basal ganglia?
Boleh?
Tourette syndrome, does it have any relation with basal ganglia?
Absolutely, yes. Tourette syndrome, one of the syndrome. Yang listkan tadi macam Sydenham's chorea, Huntington's chorea, right, Wilson chorea, right, itu one of the common genetic disorder yang berlaku pada basal ganglia. Tourette syndrome adalah one of the genetic disorder yang mana dia adalah efek pada basal ganglia juga, sama Tourette syndrome. Ada banyak lagi, right? Okay? Saya tak listkan everything. Saya just select a few genetic disorder yang pertaining kepada lesion pada basal ganglia. But Tourette syndrome also berkaitan dengan lesion pada basal ganglia. Actually, Tourette syndrome lesion pada again, dia sama juga, dia ada lesion pada striatal neuron juga actually. Yes, indirect pathway striatal neuron. Tourette syndromes. Yeah. Okay. Yes, anything else? Soalan. Yes, anything soalan lagi?
Okay. Sementara menantikan soalan daripada Tuan ataupun Puan Virus 8. Dan tadi kita ada soalan daripada Puan Kamala Bali.
Okay.
How to maintain the well-being of basal ganglia?
I think this is very common question actually. Okay. One of the why we have lesion of basal ganglia actually. Okay. One of the reason why because of is due to cerebrovascular accidents, right? Cerebrovascular accident, okay, which is you have infections of the arteries or occlusions of the artery. Usually it affect our lenticulostriatal artery or it affect our artery of Hubner of ACA, right? Okay, so meaning that in order to avoid this kind of problem, right? Okay, I think one way is we need to stay healthy, right? Okay, I think this is the general question, right? Okay, we need to stay healthy. And again, you need to have a good in terms of your blood pressure, right? Okay, right? Okay, you need to reduce your fat percentage inside your body, right? Okay, in order to prevent from occlusions, right? In the spastic artery, which is referred to lenticulostriatal artery and also artery of Hubner, right? Okay, okay, yeah, I think, but most of the lesion pada basal ganglia also, right, is related to the genetic disorder. Okay, genetic disorder, okay, meaning that if you talk about genetic disorder, basically you cannot avoid about this problem, right? Okay, but in terms of acquired problem, for example, occlusions of the artery, right, infarction of the artery, for example, right? Okay, or maybe aneurysms of the arteries, right? Okay, that ones you can avoid and you can reduce the risk, okay, having this kind of problem by stay healthy, okay. Try to monitor your blood sugar, to try to monitor your blood pressure, right? Okay, and always exercise, right? And also you need to stay healthy and try to eat clean, right? Okay, I think okay. I think that's all right. Okay, how you can maintain the healthy basal ganglia actually. Yeah.
Okay, terima kasih Cik Rizal atas
Yes.
jawapan yang telah diberikan. Jadi kita buka lagi sedikit sesi untuk sesi soal jawab. Jadi tuan-tuan dan puan yang ingin mengajukan soalan, selanjutnya boleh bukakan mic ataupun boleh gunakan chat box untuk ajukan soalan sebelum kita tangguhkan sesi kepada sesi yang seterusnya.
Since kita habis sharing ini awal, right? Sharing session ini awal, memang saya nak peruntukkan masa yang panjang untuk Q&A sessions, okay? Saya nak berbual and sama kita nak share apa yang kita tahu berkaitan basal ganglia, right? Okay? So anything berkaitan dengan discrepancies ataupun berkaitan dengan mitos berkaitan dengan basal ganglia ataupun anything, right? Okay? Maybe kita boleh share, alright? Kita boleh share here. Kita gunakan this platform untuk sharing this idea supaya knowledge berkaitan dengan neuroanatomy, brain, and also this knowledge you can use semasa di clinical ataupun you can use semasa during your class, right? And ataupun anything, right? Okay. So I think these are the right moment. These are the best moment untuk kita bincangkan atau kita discuss berkaitan dengan structure yang pada saya yang jarang kita bercakap lah, especially basal ganglia. Yeah. So anything.
Okey, jadi nampaknya dekat chat box pun setakat ni masih lagi tak ada apa-apa soalan baru. Begitu juga dengan para audience. So
maybe last questions? Ada last
Yeah.
questions. Yeah.
last question.
Yeah, maybe last question from audience. Ada? Ya. Ya, Puan, ada soalan, Puan?
Kalau ikutkan kalau nak transport guna portable tu tapi kan sebab boleh sama je. Kita lagi pun nak transfer depan. Bukan dia nak sikit lah nanti.
Ya, Puan. Tak dengar, Puan. Itu bukan.
Okey, jadi memandangkan tiada lagi soalan daripada para audience. Jadi saya rasa sesi kita pada petang ini telah sampai di penghujungnya. Jadi kita ucapkan sekali lagi terima kasih kepada Encik Mizan atas kesediaan dia untuk berkongsi berkenaan dengan Neuroanatomy of the Brain Part 2 bersama-sama dengan kita kali ini. Jadi untuk siri yang seterusnya kita akan maklumkan lagi untuk kemas kini untuk siri yang ketiga. Dan sekali lagi kami mengucapkan terima kasih kepada tuan-tuan dan puan-puan yang sedia bersama kami daripada awal sehingga ke hujung acara pada hari ini. Jadi jangan lupa scan kod QR tertera untuk pengesahan kehadiran dan juga untuk penyediaan e-sijil. Okay, jadi kita tangguhkan sesi kita pada petang ini. Jadi terima kasih sekali lagi diucapkan kepada tuan-tuan dan puan-puan atas kehadiran anda ke sesi kita pada petang ini. Jadi nantikan sesi siri selanjutnya pada update yang akan datang. Wabillahi taufiq wal hidayah. Wassalamualaikum warahmatullahi wabarakatuh dan terima kasih. Jumpa lagi.